Welcome to Ocon Healthcare's training video for insertion and removal of the IUB Ballerine. Verify that subject meets suitability guidelines. Insertion is advised during menstruation. Use aseptic measures prior to IUB Ballerine insertion. Correct insertion procedure. Application of a tenaculum to the cervix is optional for gentle traction of the cervical canal to align it with the uterine cavity. Gently insert a sterile sound. Measure the depth of the uterine cavity, check the patency of the cervix, confirm cavity direction, and detect the presence of any uterine anomaly. The uterus should sound to a depth of 6 to 9 centimeters. Use the flange to mark the uterine depth that you measured with the sound on the insertion tube. Pass the loaded insertion tube through the cervical canal until the gauge is in touch with the cervical external os. Pull the insertion tube back approximately 2 to 3 millimeters. The insertion procedure is counterintuitive. Holding the tube in place, push the rod forward in moderation to deploy the IUB Ballerine into the uterine cavity. Pull out the rod fully and then pull out the insertion tube. Cut the threads perpendicular about 2 centimeters out of the cervix by using a pair of sharp, curved scissors. Perform an ultrasound examination to make sure the IUB Ballerine is in the center of the uterine cavity. Ultrasound imaging shall be performed in at least 2 different planes. If the IUB Ballerine is not positioned completely within the uterus, remove it and replace it with a new IUB. Do not reinsert an expelled or partially expelled IUB Ballerine. Wrong insertion procedure. Pulling back the insertion tube during deployment will risk the IUB Ballerine being positioned too low in the uterus or partially in the cervix and may increase the risk of expulsion or perforation of the cervix. If the IUB Ballerine is not positioned completely within the uterus, remove and replace it with a new IUB. Do not reinsert an expelled or partially expelled IUB Ballerine. Removal. Do not hesitate to remove the IUB Ballerine in one decisive pull. Removal without strings. In case of absence of visible threads, use an alligator forceps or another grasping instrument like a hook and grasp the IUB Ballerine wherever you can reach it. The IUB nitinol frame can withhold at least 1.2 kilograms of force. Pull in a decisive manner and remove the IUB Ballerine. This is our training platform where you can find additional tools such as our ultrasound guide, frequently asked questions, and much more. Thank you for watching.